Toxic Mold Summit. The theme is Hope, Health, Home. This is Dr. Margaret Christensen at Carpathia Collaborative, and I'm joined by my good friend and colleague, Ann Shippey. Ann is an internist in Austin, Texas. She's also a chemical engineer by background and has her own mold story to tell. She and I are going to kind of give the big picture overview of the framework of what this whole Toxic Mold Summit is about, and help you understand what are some of the symptoms and presenting illnesses that are going on that mold can cause. How do you test or diagnose it? How do you treat it? And we're going to be covering that both for yourself personally in your own body, as well as for your home, with various experts throughout this. But Ann and I are going to start with just kind of giving you the big picture of what to expect while you're going through this summit. So welcome, Ann. Great to see you.
Great to see you, and thank you so much for having me. This is such an important topic, and I'm so excited about the way that you've gathered some of the greatest experts in this field, because we're really not taught this in medical school. Most doctors do not know this information, so we really need to be getting this information out in a way that people can easily understand it and digest it. So thanks for taking this on.
You're so welcome, and even in even in our functional medicine training, it has not been it's not on the top of the radar where it needs to be. And unfortunately, what you and I understand is basically all of us now, conventional docs and other practitioners, we're all practicing environmental medicine. So tell us, Ann, a little bit about your story and how you ended up with becoming an expert in mold yourself.
Well, I had actually gone to a Bill Ray conference on environmental toxicity, and the topic happened to be mold. And I was like, oh, this is pretty interesting. And I had started helping a few people in my clinic, realizing, oh, this is such a whole area I've been missing. And over a few months, I happened to have some hidden leaks in both my office and my house that I started to get some pretty severe neurological symptoms. My arm got so weak I could hardly hold a glass. I actually dropped some glasses that were full and could hardly lift my purse. I had a lot of pain in my body. My kids were pretty little then and didn't even really want them to hug me because it just hurt so badly. Couldn't wear my heels to work. My hair was falling out all over the bathroom sink. So I had multiple systems in my body that were really starting to shut down.
Wow. And so that is how your own experience led you down this pathway, and myself the same way. I was having very similar symptoms, and but this was long before I knew anything about functional medicine. And I tell my story on another episode, so we won't go there right this second, because we really would like to look at the big picture of what's the big broad spectrum of symptoms that you can see. And let's start with something obvious: upper respiratory and sinus infections. What all can we see here?
Yeah, it turns out that mold is actually one of the most common causes of asthma. So I don't think that most doctors are actually looking for, is there a mold exposure? So if you've got asthma, significant allergies, or chronic sinus infections, the first go-to should be, am I getting exposed to mold? And it's so common in our country to have those problems.
And we're talking about mold in water-damaged buildings versus mold outside.
Yes, versus mold outside, which is more of a nuisance than a critical issue. Right.
So again, chronic sinus infections, chronic upper respiratory infections, kids who are getting ear infections, or getting tonsil infections, or getting recurrent strep throats, recurrent pneumonia, bronchiectasis. These are all symptoms that we can look for.
Absolutely. Really anything respiratory that should at least be in the differential diagnosis to think about. And actually, I don't even know if I told you, but I actually had developed asthma for the first time in my life a couple of years ago, well past my first mold issue. I was in a brand new house and I thought everything was fine, but evidently some of the carpeting had gotten laid down on flooring that wasn't dried all the way, and then there were some issues with how the windows were installed.
Wow. So that is not an uncommon story that we hear.
Exactly.
So what about neurologic symptoms? What are some of the common neurological symptoms that we can see?
So a lot of times people come in and say, you know, my brain is really foggy. I'm losing my memory. I can't have the same kind of problem solving or make decisions the way that I used to. So the brain can be heavily impacted by a lot of these mycotoxins, as well as like what I experienced where I developed a peripheral neuropathy. And then it can also start to affect more on a broad scale. So things like disrupting sleep and from a psychiatric standpoint, really cause anxiety and depression. A lot of people actually, they might have had a little bit of anxiety in their life before, or if there was something situational, but just, I hear very often, I just can't turn it off. I just feel anxious all the time.
So yeah, neurological symptoms are pretty common. Recurrent migraines can be a problem, but even MS, Parkinson's, ALS, there can be a toxic mold component.
Really, every time I've seen somebody with ALS, there's been a mold component to it. It's definitely, and then also with the Parkinson's, that's also very, very common. There can be multiple causes for that. We don't want to just say, oh, everybody that has ALS or everybody that has MS has mold, but it's something to factor in when you're looking for the root cause of those illnesses. And the exciting thing is that when you do identify mold as the underlying cause, people can really recover when they have the appropriate treatment. So I know part of what you're wanting to do with this series, Margaret, is to have people have hope. You know, a lot of times people are being diagnosed with things and not given any hope that there are solutions. So I'm really excited to help get some of those solutions out there.
Right, and so we have a number of different interviews where some of these neurological issues will be touched upon. Dr. Tom O'Brien will be talking about the breaching the blood-brain barrier and the tie to Alzheimer's, and several other docs will be mentioning that too. Dr. David Haase will be talking about chronic complex brain issues and brain trauma, and again, how that's affected. Dr. Terry Walls, who has an amazing story herself, will be talking about, again, neurological issues and mitochondrial health, all tied to this. So we're going to be covering all that, and we'll be also talking about, like you said, some of the recurrent upper respiratory infections and sinuses. What are some of the approaches that we can do for that, and how important it is to get the sinuses cleaned out first while we're addressing these issues. So we'll touch on that in a second. You briefly mentioned psychiatric illnesses. We have Dr. Mary Ackerley talking about that. But what are some of the common psychiatric symptoms that we can see?
So anxiety, depression, sometimes there can even be some hallucination kinds of symptoms from some of the VOCs that are produced by the mold. There are also some neuropsychiatric things. The patients that I've seen with the PANS, PANDAS, or autoimmune encephalitis type picture, I've also seen heavily related to mold exposures.
So the psychiatric illness is a huge area, and like I said, Dr. Mary Ackerley will be covering this, but you mentioned, bipolar, hallucinations, schizophrenia, those are, as well as severe anxiety or, really severe depression and these big swings. Toxic mold can certainly be a part of that is often missed. What about in children? What kind of things are we seeing in children?
So same kinds of things with children, and definitely the PANS, PANDAS, OCD, really severe OCD, and I think some Tourette's as well. The children are so susceptible because their bodies are smaller, so and their respiratory rate is higher, so they can actually be the tipping point, the canary in the coal mine. Just often women are more affected, but also children. So pretty much any of the things that can happen with adults can also happen in children, but even some of these autoimmune issues. And then also there's been some link with autism as well.
Absolutely. So the spectrum disorders, ADD, again, so for children, if they're having, again, ADD, focus issues, OCD issues, you mentioned, again, sleep disturbances or chronic headaches, tummy aches, etc. That's a lot of the neuropsychiatric things that we'll see with kids that may be not diagnosed as, oh gosh, this can be affecting your child. And another bigger theme here from a psychiatric standpoint too is looking at addiction and alcoholism.
Oh, that's a huge one. So yes, I think a lot of times too, these mycotoxins and actually having getting the fungal infections in their body really actually change your behavior by having cravings for things. So a lot of time, and then sometimes people are also, just medicating how they feel by the addictions, whether it's the alcohol, drugs, playing video games, just, really needing to escape.
Well, we have some very interesting conversations about that whole area with Doug Kaufman and with Evan Brand as well, looking at the correlation between alcoholism, addiction, and toxic mold exposure. It does.
The thing that's so exciting is that by helping people to get into a clean environment, get the toxins out of their bodies, a lot of times these addictions and these psychiatric issues just go away.
It's amazing. It's amazing how we can help and support factors. So you touched on autoimmune issues. What kind of autoimmune issues can we see triggered?
Full spectrum. So, sometimes it's, the most common things like the thyroid, sometimes it's encephalitis, sometimes it's rheumatoid arthritis. I've had people where their rheumatoid arthritis just completely goes away when the mold's addressed. So I've started every time, type 1 diabetes, I've started anytime I diagnose on an autoimmune disorder, and especially if it's on the serious side, rather than delaying a little bit to look and see if there's mold, we'll jump right into that as part of the main possibility of what could be causing it.
Yeah, and so other autoimmune conditions, Crohn's, ulcerative colitis, psoriasis.
Psoriasis is a huge one.
Mm-hmm.
And that gets into skin conditions. Like a lot of people, the first sign of being exposed to mold is having some issues with some type of skin rash.
Yeah, so dermatologic findings are very common. A lot of histamine reactions. There's a kind of a mold rash. You can get a whole malar rash, and unfortunately, they'll be being treated with steroids and other things. So we'll be talking to Amy Myers and Jill Carnahan about the autoimmune components with this. Certainly we see a lot of gut issues as well, SIBO, SIFO.
Mm-hmm. And a lot of people actually get a nauseated feeling when they're exposed. So any kind of nausea, heartburn, bloating, gas, abdominal pain can actually just be the mycotoxins themselves. And then in addition, it can be actually causing one of these diseases that you're talking about. So the gut things can be a real red flag.
Absolutely. Absolutely. What about hormones? What kind of hormonal disturbances can we see?
So there's a lot of things linking even to things as severe as infertility and birth defects, but a lot of people have early menopause or just hormone disruption where they're having PMS. I think we're going to see some link with other hormonal disruption like endometriosis. And then when we do so, there's other hormonal things that people don't necessarily even think about being as hormonal that we'll get into with testing that like control whether you can retain fluids and keep your hydration up, and whether you can make the chemical messengers to actually drive your adrenals and other organs.
Yeah, and so for women, you're saying at early menopause. In men, we can see very low testosterone levels, a lot of fatigue, chronic fatigue syndrome, fibromyalgia, which really we should have put in neurological systems, is really common. But there's a whole hormonal component to that. This is so stressful at so many levels. We'll see adrenal insufficiency, and people kind of call that adrenal fatigue, but we have a different way of looking at that. So you mentioned thyroid, adrenal, infertility, night sweats.
Night sweats are a big flag, especially if you see them in men, but women as well. I've had people where they remediated their house and they thought everything was fine, but maybe the leak wasn't really fixed and it started, growing mold again, and the night sweats came back, and well, you gotta go looking for mold again.
Yeah.
And then finding the mold. So yeah.
Yeah, so again, it's a big hormonal disruptor, and we've talking to Dr. Shaw about that. Zearalenone is one of the mycotoxins that can be produced that we can measure now, that we know creates a lot of hormonal challenges. And then there's the whole cancer piece.
The cancer piece, it's interesting how much research there is on these mycotoxins being carcinogens, and so little of that information actually gets out. Like we, from a prevention standpoint, we should be aware of what our mycotoxin levels are, both in our homes and in our food, because a lot of food has mold in it that's carcinogenic as well. So, when we have any kind of pre-cancer or cancer pop-up, we need to be also thinking about mold exposure. You go ahead and take care of the cancer in the way that resonates with the patient as much as possible, but then to make sure that you have a good outcome, it's really important to address this issue.
Well, and we elaborated on this discussion with Doug Kaufman of KnowTheCause.com and with Ty Bollinger as well. The challenge here is that these these mycotoxins are so immunosuppressive, and that means basically killing our immune system. And I had a great conversation with Dr. Hooper about that in his interview, and then it's really messing up our body's ability to detoxify, and that's why we're seeing all the different ranges, spectrums. And what about chronic complex diseases and like Lyme and other co-infections? What else do we need to be looking for?
So definitely we're looking for total toxic load. So what are all the toxins that have built up in the body in addition to the mycotoxins contributing to these complex illnesses? But what we find is that the mycotoxins as well as other environmental toxins can really suppress the immune system. So what I see is that there are patients walking around with Lyme and other co-infections, and they're not sick. But when they're actually sick, we can usually find that there's an environmental exposure like mold that's suppressing the immune system and allowing these infections to be occurring. So the way that the analogy for that is shingles. So shingles, you have to have had the chickenpox virus, and it's the immune system is keeping it at bay, in check, in a nerve. And then when the immune system gets suppressed, then the shingles symptoms, the chickenpox virus can come out and create that neurological pain syndrome and the rash. So I think about Lyme and co-infections in the very same way, that when the immune system's working strong, it can keep it in check, but then when those toxins build up and the immune system isn't powerful enough to keep them quiet, then that's when people can actually get symptoms from Lyme, and some of those symptoms may actually be from mold and not even be Lyme in the first place.
So absolutely. So we have had some great conversations with Jay Davidson, with Todd Watts, um, and with several others, Wendy Myers, regarding heavy metals, and looking at Scott Richmond as well, looking at the total body burden issues of again, Lyme, co-infections, Babesia, parasites, viruses, and when you're suppressing the immune system, all of those can arise, and it's a little bit of chicken and the egg.
Yes,
like you mentioned, you may have already acquired those in the past at some point, but then when the immune system just plummets, those infections may resurface. And I recently had a young man who was, again, 26 years old, who had severe shingles, and you're not supposed to get shingles at 26. So we know that that was a major immune system hit with that.
So one thing I just throw in right now, so I don't forget it, is that I know now looking back, I know I lived in multiple homes that had water leaks and had mold. And they didn't make me sick. Like I feel very fortunate that they didn't. So it was probably the combination of things that happened all at once that finally my body was like, okay, this is too much. It got too broken down, to the barrel too filled up, that then multiple systems started screaming at me.
Right. Well, great. So we've covered a lot of different symptoms. So we've talked about, again, chronic recurrent upper respiratory and sinus infections. We've talked about all the neurological manifestations, including fibromyalgia and chronic pain syndromes. We've talked about autoimmune issues. We've talked about hormonal disruption issues. We've talked about psychiatric issues. We've talked about, again, chronic complex illnesses, Lyme's, and co-infections as well. And all of those can be triggered, and or toxic mold can be a component. So the hope here is when you identify that, we can treat it. So rather than treating autoimmune disease with Humira and these really strong biological drugs, which are not going after the underlying cause, or taking out somebody's colon because they have ulcerative colitis, we can work with treatments and helping to remove the total body burden and the toxic mold if we need to help recover. So let's who gets sick? Yeah, so we talked about women are a little bit more likely to, and children, because we're smaller body mass, and testosterone is actually a little protective. Jill Carnahan's talking about that. But let's talk about genetics. So what are the genetic factors that can be involved?
Genetics are a huge part of this and who gets sick. So what I found with my patients is that sometimes it's really helpful to actually check their genetics to best see how to treat them, because if they have a methylation, one of the SNPs or genetic polymorphisms in the methylation process, that seems to be very, very important for helping the body to be able to clear out. Some of the detoxification genes, so the P450 enzymes, and CYP1B1 is a very common one that I see in patients that are affected, as well as the capacity to make glutathione, which I think is one of the main ways that our bodies need to have a nice high level to be able to eliminate the mycotoxins. And then it can also, depending on the reason some people get sick is actually having an immune system. An HLA protocol that was identified by Dr. Shoemaker may also be another piece of the puzzle. And then I've also seen a link with how well the person handles histamines.
Mm-hmm. So again, genetics can be variable, and like you had mentioned, Dr. Shoemaker was one of the first to identify that about 25% of the population has these HLA genetics, making them more susceptible to not being able to clear biotoxins. However, it's a much bigger picture than just those genes, and we have Dr. Kara Fitzgerald really talking about the methylation pathways and things like glutathione, histamine, to elaborate a little bit more on those different areas. Which I think is critically important. And also, what are some of the other factors if you've had, again, head injuries and a history of trauma? Do you want to elaborate on those a little bit?
Yeah, I really, especially for the neurological things, I think when people have had any type of brain trauma, either car accidents, falls, ski accidents, playing football, maybe even playing soccer, anything that's even a risk. They might not even realize that they've had a brain injury or brain trauma, can make them much more susceptible to having the issues with the blood-brain barrier. I see that quite commonly. And then also emotional trauma. Anything that looks like PTSD. And I think part of that is that when we're more in the sympathetic state where our bodies can't really fully relax, our bodies aren't detoxifying as optimally as we should be. So I'm really happy that you're covering this topic too.
Well, that's a huge piece, and we have Annie Hopper going to be addressing the trauma. Marcel Pick does a wonderful job on both the hormonal side and talking about the hormones, and we're also talking about ACEs, or adverse childhood events, and how growing up with trauma or alcoholism, addiction, neglect, abuse, again, that can also make you more susceptible to a higher total body burden. And then you also think about, was toxic mold part of the reason why you had some of the craziness that you grew up with? But here's again the hopeful message is that we can rewire and retrain our brains. Dr. Tom O'Brien talks about this, Dr. Annie Hopper talks about it, and pretty much every interviewee I'm talking to themselves have had an issue, so we'll be talking about resilience, and that's my interview is going to be on how do we keep it, how do we keep that resiliency up in the face of these challenges. So,
beautiful.
Yeah.
I want to mention one of my favorite things that actually really helped me when I had my asthma. I knew once I had asthma and how am I going to breathe kind of thing really set me into, I know what Annie's going to cover with the limbic system being turned on, the run from the tiger continuously. I found a device called a Muse. It's a little neurofeedback device. So in addition to being able to meditate, it was helping my brain to reset so that then I could actually be in a relaxed state. It was so helpful and so powerful, and made it pretty simple.
Well, that's really important, and so we'll actually touch again on that when we're looking at treatments, how important it is to address this whole problem with sympathetic overdrive and the psychospiritual components of this journey, and because it is a long journey.
It is, and it can feel very overwhelming and very dark for people, and I think it's just helpful to know that you're not alone, that that's a common feeling when you're in the midst of it. It's to negotiate it all with your family and your work and all of that when you feel so bad. It's very, very challenging.
And oftentimes you look good, but you feel crappy.
That is so true.
Yeah, and while we're at it, let me just, one other thing about the genetics and genetic susceptibility that we have Kelly McCann talking about, and also Mary Ackerley touches on it, is the Ehlers-Danlos syndrome. And those of us who are tall and really slender and hyperflexible, that's another genetic predisposition.
Well, and that's a really interesting topic, because I think before that really came up with exploring this with who's most susceptible to mold, I think it was missing that as one of the reasons that people were just more prone to injuries. They weren't full-blown Ehlers-Danlos or Marfans, but on that spectrum someplace, and now I see it actually quite commonly.
So that just touches on the who gets sick and why. And does everybody in the house have to have the same illness?
Actually, most people will have different. And the way that I describe it is that these environmental toxins, especially mold, find your weakest link. And so one person is usually the canary that gets sick first. And then if there's enough mold and mycotoxins present, everybody can get sick. But usually it's at a different rate and different symptoms.
So you'll have one person that has nothing at all, one person who's having allergies, asthma, and some migraine headaches, and then other person. This was the story in my house. Chronic fatigue, fibromyalgia, etc. So that's
sometimes people don't realize. They think, oh, I've just been, this is what it's like to be, turning 40 or turning 50. They might be a little bit more irritable, or they might be gaining some weight, or just feel a little bit more tired and think that they're not being affected, and they don't know that they were being affected until they get the environment clean and actually start to detoxify.
Right. So let's talk a little bit about, again, just a little overview of testing. What kind of testing is available to help us diagnose, hey, is this a mold issue and or something else?
Yes. So there are a lot of options, but some of them are very expensive. So, sometimes we just know there's been a leak in the house and we just move forward and we just don't even worry about testing. We assume that symptoms fit. But you can do some urine testing where you actually check the levels of the mycotoxins. There are a couple of labs that do that. And then you can also actually check for antibody levels. It's not a direct correlation. You don't know, is it a current exposure or an old exposure? But a lot of times as there's solutions being found, the antibody levels to the mold will be decreasing.
Mm-hmm. So we can, test those ways, and then there's some other indirect testing, talk about a little bit about the different shoemaker labs.
Yeah, so those there are some markers for what the immune system is doing. So looking at and then there's also some hormonal things. So a lot of times we see a low MSH or a VIP, which most doctors haven't even ever heard of. So you have to kind of take the list to your doctor. Those, I kind of whittled it down to couple of, because there's a whole big panel. So the ones that I find that are most useful are the MSH, the VIP, and then an ADH, which is if you're keeping fluid or whether you're getting dehydrated all the time, and then a TGF beta 1. I don't usually order the others anymore because I just haven't found that they change what I do in practice very much.
And that's pretty much what I'm doing these days too. I'm not doing the whole full blown panel. I'm not doing the HLA genetics so much because it really doesn't matter. It is not going to change our outcomes, and I'm probably actually more interested in things like methylation sulfation markers on genetics. And then what other kind of testing do we want to look at, kind of trying to assess the whole big picture?
So a lot of what I'm finding too is the person who gets the sickest may also have some mold growing in their bodies. So we use some of the latest DNA probes, microgen, and there are a couple of others, but that's the one that I use to look to see if there's fungus present in whatever body fluids I'm most suspecting. So it might be sinus, stool, urine. I haven't found a good way to get the blood, but I'm on the path of a potential one. Because sometimes I think people have a systemic fungal infection as well.
So throughout this summit, we're talking to again about many of the different types of tests. I'm asking each practitioner what they're doing. You and I are also looking at organic acid testing. Again, there's a number of different labs out there.